Hello, Dr. Khaled. Yes, you can start.
Okay, perfect. Thank you. Hello and good evening, everyone, to this last and fourth session of our webinar series by VPS Healthcare in collaboration with American Oncology Society. If you haven't attended the previous meetings, what we intended to do in this webinar series is to go over certain aspects of clinical research and publications that could be useful for you in your academic or clinical journey. The first session we covered aspects related to study design per se and how to think about those in terms of planning for your research studies. And then we had a session dedicated to basics of statistics, not necessarily to apply them, but more so to understand what each test means and where it's applied in case you're dealing with a statistician or reading a paper. And the third session was to look further into results and how to interpret them. Talking about p-values, confidence intervals, confounding, adjustment, all of these things and what that all means. And what we're going to do today is we combine two sessions, the short and the longer one, but we'll try to keep this short to finish on time earlier than planned. And today is dedicated to taking all of this that you've done in your research, in your study, the results, and transforming this into a publication, transforming this into a manuscript that's sent to a medical journal, to publish in a medical journal. As I always mention at the beginning of these sessions, there's no theory when it comes to this. Most of the things that you see here are my own personal experience from the journey that I've had in the last 10 plus years, very heavily involved in publications and being an editor for journals, reviewer for journals, and publishing myself in various aspects of journals globally. But these are things that I found useful to know, and that's why I'm very happy to share those with you today. So the talk is split into two parts. So the first one is to plan, and this is the most common question I usually get from colleagues: how do I know which journal to send my paper to? I know where to find those journals. I know the journals that are in my field, but I don't even know how to plan or how to begin thinking about which journal to send this to. And this is very essential practically because one basic rule for all medical journals that they tell you and they have you confirm in a cover letter or on ticking a box when you submit your work for publication is that you're not sending your work to more than one journal at the same time. That's not allowed and a big no in the publishing world, because if you get an acceptance in both the journal, then where would your work go? So most journals make you sign to confirm that you're not submitting the same paper to another journal at the same time, which means that you need to wait for this journal to give you a decision before you go to the next one. That's why getting the first journal right, or at least the first few attempts to target the right journals will be very, very essential. Otherwise you'll be wasting your time going in circles with different journals, and it could take months until you land on the right one. Before understanding journals, you need to understand that these journals are, similar to books and magazines. They have someone that is responsible for them, the publishers. Usually the journal is owned, for example, by a society or a medical group and published by a publishing group. But sometimes the publishing group owns the journal. There are different variations of those. But at the end of the day, there are many groups, and they keep joining efforts together. For example, Walters Kluwer and Lippincott Wilkinson were two, then they joined. You have Nature Publishing Group is a big one. Elsevier and Springer, I would say, are the biggest. You have some societies that have their own publishing house that publishes a certain journal, but the BMJ Group, the Lancet Group. So there are many publishers out there that have many different journals under their umbrella. And usually the review process, I'm sure you're mostly familiar with this, at least if you've submitted a paper before, but you would mainly be able to understand the process very easily if you just commit to submitting one paper. In the old days, we used to submit the papers by simply just sending an email or by sending a fax in even older days. But now today, everything is done online. All journals have a website, submission portal. There are a few that let's say web platforms or that many journals actually use, like Manuscript Central, Editorial Manager, that journals subscribe to. and they allow you to submit your paper for their consideration there. And that's where the paper lands to the editorial office. This could be a virtual office. Some big journals, they do have an actual team. They're like more like a company that have full-time employees, but sometimes some journals are just based off of academic universities, where when we mention editorial office, that could just mean the administrative assistant of the editor-in-chief, who's, for example, a physician in a department in a hospital, and his assistant is also his editorial assistant for the journal. Usually the editorial office does a quality check to make sure that you adhere to certain guidelines that the journal asks from you. And then the editor-in-chief, or sometimes just called the editor, will it depends. In some journals only have one editor, and he immediately handles your paper. Sometimes if a journal is big, has so many sections, it's an internal medicine journal, for example, and you have a separate associate or section or sub-editors for different sections, for example, for neurology, for cardiology, for rheumatology. Sometimes it's based on regions, so you can have a journal of hematology, but you have a sub-editor for submissions coming from Asia, another editor for ones coming from Europe, and another for US. Sometimes it's for the journal category. You will see later that there are many journal categories, and it could be based on, separation as review articles, original articles, editorials. Each section has a different editor. Then whoever it handles and the main decision maker on your paper will send it out to what we call peer review. That's why we always call these journals peer-reviewed journals, because the decision on whether to accept your paper in them is not only solely based on the editor's decision, although he has the final say, but it's based on comments that come from external reviewers. Some journals have their own internal reviewers, like big journals like The Lancet. They have also their own, especially for statistics, internal reviewers, but usually they send this to external reviewers. Usually it's two, the average is two. Sometimes if they can't find reviewers or no one is having time to review a paper from all the invitations they sent for review, they end up accepting just one review, but usually the average is two. Some journals go for three. The higher impact the journal is, or the more important the journal is, they will send to more reviewers. I've got some, one time I sent a paper to The Lancet, I got comments from 8 reviewers. So it depends. During your submission process, also, many journals ask you to suggest reviewers, ones you would prefer to review your paper, and others that you don't prefer to review your paper. Usually journals commit to the ones that you said you don't prefer to review your journal because you think it's biased. There is some scientist somewhere in the UK that you have some competition with in terms of who gets some data out first, so you wouldn't want them to review your work. It's your right to actually ask for that. But when it comes to preferred reviewers, it's rare that the editor will send to the ones you actually suggested. Sometimes if they're nice enough, they do, because they ask you to suggest names that you think are knowledgeable enough to review your work in their relevant clinical or experimental background. But inevitably, you're going to suggest friends, you're going to suggest people you know. So editors know that, so that's why usually they don't send to them unless they want the paper to be evaluated favorably. The review process is usually blinded, so the reviewers wouldn't know who you are. The title page of your paper doesn't actually go to them, and you wouldn't know who they are. But now this is changing, so you have a lot of instances where it's no longer blinded to keep everything. To be honest, personally, I'm not sure why this is done. I prefer the blinded review. It decreases a lot of bias, but now most journals are moving towards the direction of everything in the open. So even the names of the reviewers that reviewed your work are there. You know them after the decision, and they're there even sometimes mentioned in the paper, which I find a little bit odd because it makes people not that honest sometimes about their review. And then after the journal, the reviewers give their comments back to the editor. Based on the comments, they make a decision whether to reject it. They don't want it anymore. They don't feel it's suitable for their journal. Sometimes they don't even send it out to review. They reject it outright. They tell you it's not suitable for our journal in terms of aim and scope. But sometimes they send it and they get comments back, and they either reject it based on the comments, they reject and resubmit it. They ask you to do some minor changes or to do major changes, or sometimes they accept it outright without any changes. One thing to note here is that when reviewers review your work, they have two sections to fill for the journal. There is the section that you see that you receive, and there is more like a secret section that they write something to the editor. So don't be surprised that sometimes you see that there are very light or easy comments that the reviewer sent to your paper, but still the decision is reject, because it might be that the reviewers were nice enough in what they said to you, but to the editor they said, I think this work is very biased and it's not worthy of publication. Sometimes even if the reviewer's comments are favorable, the editor still is not convinced with your work or that this is suitable for the journal. They might still reject it even if it's favorable. Everything that happens afterward, you're in the happy place. If the paper is accepted, you just need to wait for it to appear. In the past, we used to wait until the papers come up in the physical hard copy issue, which takes a lot of time until the turn comes. But now most journals have an option to put it out there online in the form that you actually submitted it, or in a prepared proofed form before it has a place to go into the print journal. That's even if the journal has still print journals. So most journals are now going to a completely online model. There are some things to keep in mind, that publication process is not always free. You have several fees that could be involved. Sometimes there is submission fee. Some journals charge for a submission fee, but if this is the case, it's usually very minimal, and the journal tells you this is only to handle the submission. And usually this is no more than $50 or $100, because you can submit the paper and in the second day the editor tells you it's rejected. So obviously they don't put high amounts for the submission fee, but they're still there for some journals. And many journals actually have publication charges after acceptance. In the older days, the main costs were mainly to have either color reproduction, because journals are printing your work in journals. So usually they print in black and white, but if you want it to be printed in color for your figures to appear in color, you need to pay for that, something around $200 to $300 per figure usually. So that's why I always choose an option of my figures that even if it's printed in black and white, people can still see the difference. And that's because some journals give you the option that if it's for print, it will go black and white, but you can have it in color online for free, which is usually the choice I make, because no one is actually reading the hard copy of the journals anymore. Everyone sees it online. So if it appears in color for free there, it's fine. Reprints, so as you know, the journals are having copyright for your paper. So if anyone wants to have issues or printed copies of it, they need to pay for that. So that's another fee. And now we have an option, something called open access, which is, again, in many journals, it's optional, that they give you the option to have your paper free for the public. You pay a certain fee for it, $2,000, $3,000, for example. Sometimes they call it publication charge. Once you pay that, the paper is made available for everyone. If that's not the option, then everyone that needs to get your paper, they need to have a subscription with a journal or pay $30 or $40 to even download it online and be able to read it. This publication charge or open access is becoming sometimes in many completely online journals mandatory, and that's moving the journals to more of like business models, where you can imagine that this becomes a huge business once you charge for papers all the time, such large amounts. But many authors are desperate to publish. They get some funds from their departments, or obviously many times there is some external pharmaceutical or other grant funding that makes it easy for them to cover such charges. There are many forms that will be asked for you from the journals. I wouldn't go into the details of those, but just always make sure that you're aware of what comes around the paper. It's just all a process. There are sometimes authorship forms that are requested from you to fill to confirm that all authors contributed to the work, conflict of interest, financial disclosure forms, patient consent, acknowledgement forms. If we have time, I will cover bits and pieces about these at the end when we talk about writing the journal, because most of these parts also, other than the journal sending you a form to sign and deal with, you might need to actually also put some text about this in your paper. I've covered this open access component. And now just to go into the journal metrics that matter, there are a few things that are very important for you to understand about journals, because that leads the way to what I'm going to mention about thinking of which journal is suitable for you. Indexing means where does the journal appear? Where can you find it online? There are so many resources out there. The one that we deal with most and we work with most is PubMed, which is a version or a variation or let's say a portal of Medline, a national library owned in the US by the NIH, by the National Library of Medicine. And PubMed is usually where most people want their papers to appear. So one thing to look into usually is whether the journal you're submitting to is indexed in PubMed. So if someone searches your name on PubMed, they will find the article. Most journals, when they first appear, they can't do that. So PubMed has some criteria to be able to be indexed in it. So the journals have to have some load to be there for a while, usually a year, up to 40 articles published. These are maybe now outdated numbers, but there is usually some criteria before a journal comes on PubMed. That's why sometimes we get a lot of invitations from journals to publish in them, but I immediately look, if it's not at least PubMed index, I maybe sometimes wouldn't even want that, unless obviously you want to support this journal. The other most important metric is the impact factor, and this is a measure of how well read and, more importantly, cited the journal is, and it becomes more like a competition. This number becomes a golden number. It was used to be managed by Thomson Reuters. Now it's managed by Clarivate, an agency that does a lot of these analysis, and it's a number that reflects how many times each paper that's published in this journal will be cited by others in the future. So there's a formula to calculate it. There is no rule of what's a high or what's a low impact factor, because if you look at different disciplines, if you look at oncology, for example, the range of impact factor goes from 0 to something in the hundreds for one of the, let's say, extreme journals, the one CA Cancer Journal for clinicians, the one that actually puts all the epidemiology from SEER data. So obviously it's very much cited. But if you go to the next in lines, you see journals up to 40 and 50 and 60 in impact factor. While if you go, for example, to ophthalmology, you see that the range is 0 to 5, for example, because the readership in ophthalmology, the group of readership is smaller. Oncology is a much more practice discipline per capita of physicians. That's why you have more readership there. So usually we divide for each category. So whether you're in rheumatology, hematology, etc., we divide the impact factor to quartiles, and we say if the journal is in the first quartile, the first 25% of the journals, the first 50%, 75%, etc. There are many other things that you need to look into the journal. How frequently is it published? Is it a weekly journal? Is it a monthly? Is it a bi-monthly, every 6 months? How many times papers in it get cited, not only cited, sorry, but downloaded as well? Sometimes the rejection rate of the journal is there. It's disclosed. They tell you we reject 50% of the papers we receive, or 80%. So that tells you something about them. And sometimes they publish their timeline, that how much it takes from submission to first decision, from first decision to publication. Everything about the fees, if they have online early version, color reproduction, all of these things are things to look into the journal. You can find them on their website. And then obviously they also tell you about their aims and scope, what they're all interested in, who's their readership. Is it clinical hematologists? Is it pathologists? Is it transfusion medicine specialists? Is it laboratory medicine specialists? And also there is a lot of stuff about the journal in terms of which categories they accept in this journal. Do they take original articles, reviews, letter to the editors, case reports or not, and the limitations for those. And then the journal policies, whether they allow you, for example, to have a sponsor or a medical writer assistance that is paid by pharma for a review article or not. Sometimes they tell you we do not accept this. These are all of, imagine how many things there are out there for you to look into before you decide on a journal. That's why whenever I look into a journal, I first think of what is my message? What am I trying to convey in my paper? And who is this message for? So it can be different. So it might still be an oncology subject. So you're talking about breast cancer, but maybe you're talking about ophthalmologic manifestations of breast cancer metastasis, for example. So Is your audience then ophthalmologist? Is it oncologist? Is it GPs? Is it nursing practitioner? You need to keep the audience in mind, and that's the most important thing, because that's where you need to connect with someone. And you need to obviously understand which journal category is most suitable for you. And these are the ones that I mentioned here. We have original articles, short reports, reviews, case reports, editorials, and many other sections, which is what I will cover in the second part of this talk, and talk about how to think of these and how to write these. So when I'm thinking about the impact, the journal, I look first about the indexing. As I said, I would like my work to be PubMed indexed. If it doesn't matter for you, then you can forget that. You can go to a journal that doesn't appear on PubMed, which will inevitably not have an impact factor usually. I usually prefer to be PubMed indexed. The impact factor, that's a moment of honesty for me, because I need to make sure that I really personally understand how good is my paper. If I really feel I have like a rocket science discovery in my paper, then I'll aim high. I'll shoot for the highest impact factor, and I will keep persistent. In big journal, I'll submit it to the New England, and if not to the Lancet, then if not to the JAMA. But sometimes you need to be modest with your thinking and understand that you have limitations, that maybe this work is very regionally maybe important, but not important for a global audience. So that tells you at least that maybe you would need to go to a Q2 or a Q3 in quartile impact factor journal, rather than spend time, submit it to a journal, wait maybe for a month or two until they come back and tell you it's rejected, then you go to the next one. Maybe just be modest and know where to go from the beginning. It's easier. I also obviously look at all of the other things that I mentioned. If they have the journal category I'm interested in, so if I'm submitting a case report, I obviously need a journal that accepts case report. They tell you that in their guidelines. And the aims and scope are very important. And the way I actually usually understand if the journal would be interested in my paper, I look at the past 3-4 issues of this journal, and I see the topics or diseases, because it could be the British Journal of Cancer. But then I look back at the last 3 issues, and I can't find any paper on hematologic malignancies. And I know that British Journal of Cancer in these days, they're focusing on solid tumors, so I'm not going to send the paper on leukemia to it. One very good way actually to find the best, most suitable journals for your work is to look at your own reference list, because you're citing relevant work. So if you see a journal that's always appearing in your reference list, let's say the International Journal of Hematology, then obviously this journal is interested in your topic. So I would maybe target it as a strategy. And there is a lot of stuff about geography, politics, familiarity. So I wouldn't send something about my own experience that's very limited locally to American journal of something. Again, familiarity, you start knowing from your colleagues that, oh, this journal is always rejecting our work for some reason. Let's not blame them for anything or any bias, but just, you know what, let's just forget sending the. So you start familiarizing yourself the more you do that. The last thing in this part that I would go over is to talk about interest inquiries, which is something that I recommend everyone to do, because it saves a lot of time. Sometimes, not every time, because you don't want to always bombard the journals. When you have a topic that you're still not sure how to deal with it or what to write about, like a review article, sometimes I send an inquiry to a journal to already ask them if they might be interested in me writing a review article about thrombotic complications in pancreatic cancer patients, for example. And I put a small outline, because the editor might see my profile, see the outline that I put, and they actually say, yes, we welcome. Obviously, it will still go to peer review, but we welcome you to submit this. And they actually open a section for you to become an invited review in their submission portal. What you've done here is that you bypass the step where the editor will check if it's, you know, of interest or not to the journal. You wait 2 weeks until they tell you it's not. You bypass this step, and since the editor said they're interested in it, the reviewers become a little bit more mild. Their purpose is not to see if it's rejected or accepted, it is actually to help you make it good, you know. So their comments will be more constructive than they are just to put you down and tell you that your work is not worth it. So looking at writing the manuscripts, I'm going to go into each of these briefly, maybe probably spend most time on the original article part, and try to, as much as I can, give you the tips and clues about writing this section, and then going over the others in a more a brief way, just to tell you that they're there, they're out there, there are something to think about. So in an original article, the main sections are obviously, I'm sure you've always been exposed to this IMRAD structure, introduction, methods, results, and discussion. As I put here in the slide, the introduction is to say, why did you do the study? The methods is where, when, and how you did it. The results is what did you find? And the discussion is what does it mean? So keep those in mind. There is no rule on how to write the journals, those sections. In terms of how the journal displays them in the paper, so usually most journals, they put introduction, methods, results, discussion. Some journals, like especially the ones that focus on basic science, they do introduction, then immediately results, discussion, then the methods section, which is huge. It's left till the end because it's like a laboratory, sophisticated, complex study. The way I write my paper is I usually start with the methods and results as my core, because I really need to know what am I sharing as results, as findings, before I go back and say, okay, now let me see how I should introduce them or how I should discuss them. I wouldn't start with the introduction, and I don't even know what I'm gonna share in terms of results, because as I will mention later, you're not always sharing everything you found in your study. So that's one recommendation. Start with your method and results, and it becomes very easy to write an introduction and discussion for those. So within this method section, sometimes it's called materials and methods, patients and methods. It's a recipe for your study. Imagine that if someone will actually read this part, they will be able to go and repeat the same experiment or the same clinical study. It allows people to judge how valid and generalizable the work is. And there is no universal rule on what subheadings to put in it. Usually the only section that we always put it is the statistical analysis section, but then you can divide your methods however you want. Patients, eligibility, study design, data collection, assessments, measurements. If it's a clinical trial, usually you have those sections. If it's an observational study, I keep it one block. I don't even divide it sometimes. I just have a statistical analysis part. The most important thing is to include all of these elements. Think always that because you did the study, it's very easy for you to imagine it, but it's not easy for the reader unless you give them the right information. Who were the patients that you studied? Where did you get them from? How did you sample them? What was the time frame of your study? Just imagine, tell them a story in the methods. Tell them that, you know, we took, you know, and from the date of 1/1/2020 until 31 June 2021, every patient that entered our hospital was included and showed evidence of a chest pain in the emergency department was included in the study. Or we took all patients, we looked into our charts for all patients that were alive and attending our center in 1985, and we followed these patients through the charts until 2000 to see how many of them developed a thrombotic event. So always tell them the time frame, the people, how you found your patients. Don't get too much complicated with the retrospective, prospective, and obviously you need to mention the study design that we spoke about in session 1 in the beginning, but then imagine you're just telling a story. Don't get too confused with the wording. It doesn't matter the wording. And obviously you need to always say, how did you do your assessment? So if you said, and we looked for those who developed a thrombotic event. So did you have a solid definition? So did you, for example, only said the patient had thrombosis if they had a confirmed ultrasonography and a chest angio or something for a PE? Or did you just look at the chart at some section in the beginning or in the end of the chart to see if it clicked as a yes? Just tell the reader what they need to know to be able to validate your study. In the measurements, in the methods, you can also, obviously, if it's a trial, you put everything about the intervention, which drug you gave, the dosing, randomization, landing, all this stuff. And there is a section usually for ethical considerations, the ethical committee approval, patient consents, etc. Most journals ask you for a specific wording there, and some ask you to put it at the end of the paper, but many ask for it in the methods section. Some general tips. The methods section should resonate. It's a mirror image of your results. So do not mention methods that you applied, but you're not going to show the data of. So if you said we measured blood pressure for all patients, but you don't show the values of the blood pressure, so why mention it to begin with? But also don't omit methods, and suddenly someone is reading in the results and they found that you did a certain blood test, but you didn't even mention it in the methods that you did it. Define and don't describe. Obviously, no report of results in the methods. I see a lot of people just usually describing the mean and the gender distribution, let's say, of the population in the methods. That belongs to the results. In the methods, you need to only focus on describing the eligibility, for example, to say we included patients from both genders, we included patients above 18, but you don't report the final mean of your population that you ended up with. Always use the past tense. There is nothing to be confused with in the methods. It's past tense. And it's okay to use active voice. I see many people, they worry about saying I or we. Obviously, you're an author group, so you can always say we measured, we did. That's completely acceptable and fine. It doesn't have to always be in the passive voice to say blood pressure was measured. You can always say we measured. That's completely fine. Obviously, sometimes I see people also expanding the method section more than it should be, because you don't need to describe. Okay, if you assess the patient's serum ferritin for iron, you don't need to go and describe how a serum ferritin analysis happens. If it's a new technique to measure it, maybe you can reference the methods itself and put it at the end in the references. Try as much as you can not to describe the very standard procedures, how you measure the CBC. You don't need to tell them how you did that, but obviously for new exploratory labs, etc., you need to do that. You always can put tables and illustrations in the methods. Some people think they can only put that in the results. Obviously, if you had you measured 6 outcomes, cardiac disease, diabetes, etc., and you want to say how they were defined, you can better maybe put a table to show that rather than have a long text for it. There are many guidelines now that guide you on how to write the paper section, especially the methods and results. For clinical trials, these are the consort, and for observational studies, these are the strobe guidelines. And I invite you to look into these always before you submit your paper. Some journals ask you to sign a checklist that you looked into all of the aspects that these guidelines ask from you. In the statistical analysis section, always try to let the statistician that helped with the paper write it. Obviously, you need to mention which analysis were used. Start with the simple ones, descriptives, bivariate, multivariate, and then go into something that's more complex. If you used a certain threshold, you divided your data around the hemoglobin of 8. You need to. That's where you need to mention why did you do that. You always need to explain yourself in the statistical analysis. Obviously, you can. You would write your endpoints if it was a trial there, power calculations for sample size, confidence interval, p-value, all those standard statements. If you had missing values in your paper and how you dealt with that, did you just replace them by the average? Did you ignore them? Did you do sensitivity analysis? And sometimes journals ask you to put the software you use. To be honest, I don't see why that is relevant. I usually don't unless it's asked of me. But sometimes they ask you to use, say, you use SPSS or SAS or Stata or something like that. The main things that you don't want the reviewers to say about your method is that it's too short or it's not enough detail. I can't imagine how these people did the study, or that you're not following the guidelines. In the results section, obviously, you're not going to report every single result that you have. It's not a confession book of what you found in the study, only the things that matter. But also don't omit data just because it's not looking good. It's not a significant p-value. Obviously, always try to resonate with what you said in the introduction and the aims. Well, why did you do the study? And try as much as you can to rely on tables and figures in your results for many reasons. One, save time. For the person that is reading from finding things, they can just go back to a table and figure. This is what people usually take from your paper to present in congresses to give you visibility. If you just put everything in a text, they have to create tables from your own paper. And also, one thing that is definitely probably the most annoying thing for reviewers is when you repeat the data. When you put it in text and then you repeat it in a table and sometimes even a figure. Try to avoid doing that because it's all going to be on one page. Why do I have the same data in a text, in a table, in a figure? I just need one. Journals think of size, they have limitations, they think of cost of printing. So the shorter the paper is, the better. So for example, the way I do it is like, look at the table here on the right. It has information, it's easy to capture, and then I can actually describe this table in the text, but maybe comment on two things only from this table. I don't need to go ahead and say age was different between group A and B, that much versus that, and also male and gender were similar. It's very clear. Maybe I will just comment on age because it's statistically different. I just mentioned that in the results, and maybe ECOG status because I think it's clinically relevant, even if it's not statistically significant. And then at the end of the statement, I will say see table 1. So for everything else, gender, previous chemotherapy, etc., people can just look at the table, which imagine in the PDF, maybe when you submit your paper, you put the tables and figures at the end usually in the Word file, but in the PDF, it's going to be just there. So it's not that hard for someone to look at the text and the table at the same time. In terms of a preferred approach, I usually go for univariate analysis, bivariate analysis, and then multivariate analysis, the ones that we mentioned in the previous sessions. Use always past tense. And try to, as much as you can, to be very logical with your decimal points. So you don't need to always just report the numbers like they come from the statistical software. An age of 31.265 means nothing. You can just say 31 even. I wouldn't even put a single decimal point for an age. For things like blood levels, usually it's 1 decimal point. Maybe the only place where I go more than 1 decimal point is confidence intervals or p-values, because they help comparison sometimes, and sometimes when you adjust them to the nearest integer, you lose a number that is relevant. But for everything else, I don't see why you would need to report more than a decimal, unless obviously you're dealing with something that's already in the decimal points. Then obviously just be logical about it. There is no rule there. I mentioned these things already. To ensure abundance for tables and figures, usually always put your tables in the main Word file of the text at the end, unless the journal asks you not to, and to submit it as a separate Word file, but don't submit them in Excel. For figures, you usually put the legends of the figures at the end also of the manuscript under a heading figure legends, and you put them, but the figure you need to supply it as PDF, EPS, TIFF, TIFF, image. Try to involve someone that has expertise in this so that you can get the best quality figures. Many times you lose your nice figure when you convert it to an image like JPEG, etc. I never do that. I usually use Adobe programs to have proper figures to submit. Again, try to always, for tables, use them for comparing data, and try to always be inclusive. Like you look at the example of the tables up and down, where if you just say metastasis 20% versus 20%, it probably means nothing. But if you actually do give details that this was a group of 40 and this is a group of 40, but in this first group we had 35 or how many patients missing, so I'm only measuring 1 out of 5 rather than 8 out of 40. That gives the reader something more, that in group A there was something wrong, there was missing, so it might be biased. So try always to also give footnotes. If you put any abbreviations in your table, define them in the footnote, and you need to sometimes explain things like I show here in footnotes and such. With figures, I always say try to avoid complex figures that people can look at and not read. If that's I always prefer figures to tables, unless it's something like this case, where you look at these lines, you can't even know where to start or what to look at. It might be just much easier to put it in a table where people can actually compare numbers to each other. Again, these are things that we mentioned about figures. So with your results section, again, what you don't want your reviewers to say is that there is a lot of repetition between text tables and figures. As I said, this is the most important thing. Too confusing. There are so many back and forth in the results. Always try to keep a structure, and that the data presented is not matching the methods. How did they? I just saw this number. They didn't even tell me that they did this ROC analysis, for example. Now that we wrote our core, we go back to the introduction and discussion. In the introduction, just remember your target audience. So again, like the example here, if I'm doing a paper about lung cancer and I'm submitting into a general medicine journal, I might need to explain a little bit about something relevant to lung cancer, the novel aspects of it before I start about my specific aim. But if I'm submitting to a lung cancer journal, I know that the readership are lung cancer experts. So I don't need to tell them lung cancer is a cancer that appears in the lung. So obviously you avoid things that are too obvious. And I would also always be brief in the introduction. Avoid long descriptions. You don't want people to be bored before they get to the juice, to the methods, to the results, to the thing that is important about your paper. And at the same time, those introductions are meant to just put the aims in context, not to make a review article and then start with the results. And try not to copy. Many people take similar statements and they copy them from the discussion to the introduction. Try to always say interesting opening statements. Nothing cliche that the first case of something was in 1952. Who cares? You know, we're talking about what happens recently. Just say, for example, management of triple negative breast cancer is still a high unmet need. In the last 5 years, there have been several new products, but the survival remains a challenge. Something like that, just to put things in context. You don't need to refer to all previous studies in your introduction. You keep that for the discussion. Just refer to, maybe use reviews or recent reviews to refer to what the status of the literature is today. And maybe try to keep the criticism in mind. You don't need to, because maybe the papers you're criticizing to say something about is actually the author of them is reviewing your paper, so you don't want to do that. You need to always be obviously respectful in science and not to say all previous studies are limited, short, and they're just plain garbage. You can't say that. Everything in science made us learn something today, and that's why we're doing this study. And then at the end, you state your hypothesis. What are you trying to measure? Avoid those things to say the first study, the largest study. These are becoming cliche, and sometimes they annoy the actual reviewers. Unless it's something, you know, you did the first clinical trial ever in the last 10 years, nothing has been done about a study, that's fine. But if, you know, you're not even sure if it's first, if you've done literally a proper literature search and you really did the first person to do this, then yes, I would beef that, but don't overuse it is what I mean, especially if it's something that maybe it's the first because it wasn't that interesting, that's why no one did it before. Let's sell your paper by the aim that you did a proper study to address an unmet need. It doesn't matter if it's the largest or the first, as long as it was a proper study. And I wouldn't actually do a lot about, focus a lot about a country or a center experience, because you make your paper look less generalizable. If you say this is our experience in the center, maybe add to it something that you don't want, that you know, this is for lessons learned by others, for others to benefit from. In the discussion, the suggested structure is an opening paragraph to repeat your results, but in lay words. So we found that there is an association between smoking and lung cancer. You don't need to repeat the results. The one thing that I always find is people start putting the numbers again, but you just did it in the results. People just read those. You shouldn't write them again in the discussion. And let's say it's a very important number. It's the main number, you know, to say we showed that we can achieve 25% reduction in the rate of something. But don't refer back to the tables and the figures of the results or the numbers themselves or the p-values. People already read those. Now it's a time to discuss, not to repeat the results again. After this introductory paragraph in the discussion that says the findings again, I start comparing to other studies in the literature. I don't need to compare to all of them, but maybe the main ones that are linked. And again, here, be easy with the criticism. Say why your data is different from them or the same. And then the most important thing is you don't need to discuss all your results, only the main ones. And then you leave a paragraph for limitations. No study is without limitation. And then the conclusion, where you start to say, repeat again one line, the main conclusion of your study, and say what could happen in the future. In the actual by your group or by others, what your study should lead to. And the limitations, Don't make it just a confession paragraph to say everything wrong about the paper and that's it, to feel that you're now got away with it. Because that actually, when I'm reviewing papers, I go to that paragraph first and I start seeing the limitations and I actually use them to sometimes reject the paper. You need to say why it might be okay. To say, okay, we had this missing, but we adjusted for it by doing that. Our study is retrospective, but it's hard to do a 30-year follow-up prospectively. That's why this is the only way to find the relationship between this and that. So always give a reason of why it's okay. And this is how your paper should eventually look, that the methods and results are the focus in the center, and then you start general introduction, you get more focused methods and results, and then you go general again. When you write the abstract, which you should do at the end, obviously, it's a science on its own, writing the abstract, because it's the first thing that the editor will look at, and he might judge your paper based on your abstract. So you really need to get this right. And there is sometimes very limited, they give you 100, 200, 300 words. So always be brief in the background and the conclusion, make them one line. There are limited studies about this. That's it. That's sometimes only my background. And then the conclusion to be also very brief. The results, let it be the biggest, because they need to see what's new. And you need to always try to find ways to cut down on the number of words. Just keep repeating, try to remove words that you don't need rather than data that you don't need. And as an example here, if every time you put a plus or minus, you keep a spaces between them, that's 3 words. If you cut them shorter and cut them stick to each other, they actually can become 3 words. So what you need to actually focus on, as I said, is the results, the key ones that you think are most impressive. And at the end, you need to put keywords after the abstract. And one thing to note is that some people don't know actually that the keywords are there just for the paper to be found when they search for it, not just to say what it's talking about. For those keywords, try to not use actually words that appear in your title already, because the title is already included in most search engines. So I usually use different words. If I said the word management in the title, I use treatment as a keyword. If I said the malignancy, I say oncology or cancer in the keyword. So just keep that in mind. There are these 4 sections that I would cover very quickly. The title of the paper, how to choose the best title. You have many ways. You can either be, obviously, you usually shouldn't use any abbreviations. Most journals ask you not to. I like those titles that come with a colon, that it's the first part and then a second part. Some journals ask you to mention the design of the study, like the Lancet, for example, journal group. They tell you, they say, okay, impact of certain chemotherapy on breast cancer, ... a randomized placebo-controlled trial. You have to mention that. Some journals like the New England are very brief. They say the name of the drug for breast cancer. So you need to see the style of the journal and try to match it, but there is no rule there. You can always have something that's abstract, so axillary lymph node ratio and breast cancer. You didn't say anything about it. Versus the research question, association between axillary lymph node ratio and risk of metastasis in patients with breast cancer, for example. Or sometimes you put your finding in the title. So at the end you write it, you say, there was a very high positive correlation between this and that. That's actually my title. It's like very catchy from the beginning. So there is no rule for that, and each person have their own style. Authorship is, again, a very big business to deal with. Officially speaking, journals ask for 3 main criteria for a person to be mentioned as an author: that they need to have participated in research design, acquisition, analysis, or interpretation of data, drafting or review of the paper, and approval for it to be submitted. The one thing I urge you to do is never submit a paper to a journal before all your co-authors send you in writing that they are okay with it. As much as your friend and colleagues, sometimes some people don't like the fact that a paper was submitted without them knowing, or they didn't agree to something with it. And if they go and tell the journal that I didn't approve for the paper to be submitted with my name on it, that creates a lot of trouble and embarrassment with the journal, and sometimes the whole publisher will X you from their portfolio. So always make sure you have written confirmation from all your authors that you are able to submit the paper, that they allow you to submit the paper as a corresponding author, which is the person that takes the leadership for communication with the journal. And then again, drafting, if the paper is not actually an original article, then there is, the first part doesn't apply much. There is no research design, etc. So you can make it like the conceptualization of the paper, who did that, and then who supported the drafting and review. Now, obviously, it is no surprise, and transparently, in many cases in our region and also elsewhere, we do have papers that are on the paper just because they're our friends. We just put their name out there. That shouldn't be the case. That's unethical in the journal world. There has to be some role for everyone that's on the paper. And the opposite is more alarming, when some papers do a lot of work, research fellows, assistants, but they don't get acknowledged properly in the authors list. And that should be a big no. Everyone that had a role in the paper should be in the authors list. Now, some people who had a very minor role, maybe they helped with something small, they don't comply with all these criteria, they can be acknowledged. You can thank them in the acknowledgement and not in the authors list. The second thing to mention is that is the order. Does the order matter? There is no way to decide on the order. This is something you need to agree on. I advise you to do it early on in the paper before you even agree on the project. This should rely on who did most of the work, whose idea was that. Usually the first author and the last author have the most important position, and then maybe the second, third, and then everyone else. You can always go alphabetical if everyone did the same thing. You can always have, usually the first or the last are the corresponding, because also being the corresponding author gives you some sort of weight. Sometimes you can actually assign two people as the co-first author and you put the star down. You said they contributed equally as co or as corresponding. People try to make many variations to please as many people as possible, because you would want your name to be in the first or second or the last or something visible for the paper. And if you're in an academic institution, that might actually be the case. That's very important for your promotional ladder, that the way your research productivity is calculated is based on the impact factor of the journal and your position as an author. The last thing to say is that you see many times now, especially on those studies where you have 30, 40 authors on them and the journal only allows you to put 10, then at the end they put the name of the group, and then they mention everyone as contributors under this group. So you have 10 authors, for example, and then a name of a group, and then the list of contributors that belong to this group. In the past, they didn't appear on PubMed, so people didn't want that to happen. They were only appearing in the paper and the acknowledgement. But now, even if you're in the contributor group, you do appear actually. You click on it, it lists who those are on PubMed. So even if someone searches for your name, they can find you. We covered all of this. In terms of acknowledgements, we need to always acknowledge, obviously, people, like I mentioned, that had some sort of role in the paper, but wasn't enough for authorship. But you can also thank anyone. You can thank someone from the family. You can thank patients. You can thank people that supported you in a certain way, not necessarily on the paper itself. Disclosures are very important, and most journals ask for you to put those at the end of the paper and also fill them online and in some form. Conflicts of interest is if you had any relationship with pharmaceutical companies that paid you honoraria, consulting fees, research fees. Sometimes they ask you for the work itself or for previous work in the last 3 years. Don't be shy to mention those, because if it's uncovered that you had a relationship with a pharma, that you get a payment, and you didn't disclose that, it also creates a very ethical problem with the journal. The fact that you have conflict, I have at least, maybe when I write my papers, I have maybe like 10 conflicts of interest listed there. It just says that I'm involved with pharmaceutical companies to develop new drugs, to do research on new patients. So I don't know why some people feel that they shouldn't mention those disclosures. Obviously, if you're in some certain governmental positions, like in the NIH, for example, there are some rules on about those that you don't receive money, but it goes directly to your institution, etc. But you just need to disclose all of that. And obviously, if you receive any specific funding, a grant for the study, you also mention that in that section. And now many journals are asking you to put a statement about data sharing, because there are many now new trends on that the data that you use to do your study anonymized, you made it available for the public if they want to replicate or use this data. Obviously, you might have rules that you're not allowed to do that. It depends on where you are, the country, the institution, but usually there is a section at the end of the paper to describe that. For every type of paper, I put an example. I don't need to go through that. It's just an example of an original article of mine, just to show you how the sections go. But because I want to be brief on time, I'll just go to the other sections. The short or brief report section, it's similar to the original article. Many journals have it. It's just shorter. So if the original articles, they allow you 5,000 or 6,000 word, they usually in brief reports, they usually allow you 1,500 or 2,000, for example. Usually the types of papers that go there are studies that are small, have some limitations. So again, it's that confession session between you and yourself to say, you know, I can publish my paper as an original article in a low impact factor journal, but maybe I can go to a high impact factor journal and admit I have some limitations in my work. So I'm not submitting it as a full original article, only as a brief report. Sometimes it's actually the work itself is very brief. There isn't much on it. Why should I write a full original article and fill it with junk? I can only write a brief report. The way it's structured is the same. It's introduction, methods, and then the results and discussion are combined. But simply the limitations are in the number of words you're allowed, the number of references, the number of figures and tables that you're allowed. For example, this is one example of mine, a study that I've done a while ago, 10 years ago, and it was first of a kind in the sense of looking at a certain disease parameter, and I obviously didn't mention that was the first, but I acknowledge that it was on a small group of patients, around 60 patients in a rare disease. Didn't look into many actual aspects because we had limitations, but I still got it accepted in Blood, the #1 journal in hematology, simply because I went to that brief report section. If I went to an original article, I probably wouldn't have been able to publish it there. Review articles can serve different purposes. They can be narrative expert review articles, where you're just reviewing a topic, similar to how we find in UpToDate, etc. But it's a little bit more concise. Reviews are the cutting edge, recent science about the disease, about the treatment, about the complication of a disease. These are usually written by experts, sometimes invited by the journal to write them because you're an expert on a certain topic. While we have the other types are the more systematic reviews, which could be meta-analysis. We talked about them in the first session, or reviews that have some sort of methodology. You're not just looking at the literature subjectively and writing your expert opinion about it. You're more so looking at it systematically, finding certain papers and making some judgment based objectively on the finding of those papers. And also sometimes in the review section, that's where you see guidelines or consensus opinions, so non-data driven aspects of publications. Again, just to show you a few examples, this is, for example, an expert review article on the left we published recently in the New England. On the right side, again, a systematic review that we published in Blood, looking at certain fetal hemoglobin inductors in thalassemia, and it became a CME article because it was done systematically. So you're able actually to be asked a question about it by the journal, and if you answer right, you get CMEs from the AMA. The one on the left is updates in clinical trials. That's also another section that some journals have. It's more of an expert review article, but very detailed, dedicated to update and clinical trials. The one on the right is comes under critical review, but it was a consensus expert opinion. So all of these come in the format of a review article, which doesn't have sections. You can divide it the way you want. But the one thing I always advise in reviews is keep them full of figures and tables, because that's why people go to reviews. It's like you going to a book chapter to understand something new. So the main thing I would want to look at is a nice figure summarizing everything rather than having to read a 10-page article. Case reports are case report. As the name implies, they describe a single occurrence. We talked about these as a research design in the first session, but they are mainly there to report interesting findings, the first adverse effect of a drug that wasn't reported in the trial, an off-label use of a drug that you were using it for something, but you saw a benefit in another part. They can also be educational, just to say how difficult it was to treat the patient and how you did it successfully. And usually the sections are introduction, case description, and then discussion. Very limited. Many people like this concept of case report and review of the literature. Journals like that because it's a rare case report, you can put a table detailing previous cases that are also reported in the literature of a similar finding. To be honest, most journals don't have the case report section anymore. They don't like them anymore because they're rare. They're rarely cited again by others until a rare occurrence happens somewhere. So they decrease the impact factor and how it's calculated. So now you see that many of the big journals don't have a case report section anymore. Yeah, that's just an example of a case report that we published. Editorials and letters. So editorials are invited usually by the journal. So the journal, when they have an important original article published in a certain issue, sometimes they invite experts to write an editorial to introduce it. So it comes at the beginning of the issue, and then it says in this issue of the journal, there is an article by Musallam and colleagues that talks about this and this. This is important. They give some sort of opinion. They're usually senior people in the field. And then you have letters. Letters to the editors are a favorite option of mine because they can actually be used for many purposes. Many journals, the main purpose of them, the letters are sometimes called correspondence, is that after an article is issued in a journal, the journal allows you for up to 6 weeks after to write something against or pro this paper that was published, just as if you're discussing it in the journal with the authors, to say, I read with interest the article by X and colleagues, but I don't agree with their finding, etc. Because so it becomes like a dialogue, and journals like them. And once you write that, they actually ask the original authors to reply back to you. But sometimes letters, the journals tell you can put anything in them. The only thing is that they're very short. You're allowed 1,000 words, maybe one figure or table, but you can put a full research study in them. It's just one block of text. You don't need to divide it in sections, intro, methods, but you write them like that. You write the background, methods, results, discussion, but very brief, just the very brief, the concise description of your work. You can actually even sometimes put a case report in a letter. That's why I always find them a way to get myself into high impact factor journals, because I went to a letter aspect. Usually they're, I wouldn't say they're easier in review of letters, but they accept many more of them than they accept original articles. So your chances are higher. So for me, even if it's an original study, I'd rather have it as a letter in the Lancet than an original article in a low impact factor journal. And I'll show you a few examples here. This is, for example, a letter I wrote in response to a paper published in JCO where I didn't like what the authors did, looking at a topic that I was recently working on, axillary lymph node ratio in breast cancer. And then the authors replied back, and their title actually was very direct because probably they were annoyed by me, and it was replied to KM Musallam. That was the title of the article. And they repeated the analysis, and actually it was apparent that what I was saying is true, and they changed the data from the paper that they originally published. This one on the left is a full article, actually, an Orient study, a study that I've done on thalassemia patients in Lebanon and Italy. That as much as the results were very important, I didn't want them to go to a lower impact factor journal because at that time there was some challenges with the number of the sample of the study. So I still sent it as a letter to a high impact factor journal, Hematologica, and they accepted it as such. Obviously, I'm just showing one page of it, but it was a full publication. This one on the right, for example, is an editorial. We were invited with a colleague to write an editorial about a new iron chelator that the clinical trial was published in the journal Blood. So they asked us to write an editorial, and we just call it something interesting, like the new chelator in the house. And we wrote about the history of chelation and then how this new advance is important to patients and so on. This is also an editorial that I was invited to write actually about the paper in another journal. Some journals do that. They let you write about an editorial in a editorial on a paper that's published in another journal. So again, you write it with a catchy way. See here, it says evaluation of, and it's in another journal. The last section to cover before we close, these are all the other sections that many people don't know they exist. Probably they're mostly available in higher impact factor journals. So again, they're your way into those high impact factor journals. And the best way to do it is to show you some example. For example, and they usually work mostly for case reports, because if you're not able to publish your case report in a good journal, it might be that you shouldn't be looking for a case report section, but rather to images, for example. Maybe in your case, actually, the most important thing is this nice CT scan that shows something magnificent. So you can actually just submit it as an image section in the journal, and with the legend. It's very small, I know, it's one page, but you still have it in the New England Journal of Medicine, for example, maybe. Sometimes some journals have a quiz section in them, so where you put the case report and you ask the reader, what do you think this is? And then the answer comes on different pages later on. Something like that will actually be very interesting for the journal. So I at least personally found this a way when I was, in the period in the hospital working with my professors and finding these nice case reports on the floors and in surgery especially and so on. I found it a way, and it became like something addictive. I always was searching for some interesting way to publish a case report rather than just report it as a case report. Some examples. This is, for example, I always show published as an image in a very good digestive surgery journal, where a patient came into the emergency room, for example, complaining of shortness of breath, but he looked a little bit not clear in mind, and we didn't know what's happening with him because he was short of breath. We sent him to the X-ray, and then the radiology fellow called me and said, "You need to come down." And I looked at this radiograph on the left, and I was a little bit, I'm like, where was his, what is this? Where was his hand? He's like, no, there's no, his hand was down. So apparently, long story short, we discovered this patient actually has a history of schizophrenia, and he wanted to stop time, for example. That's at least what we deduced. So he swallowed his watch, and it was very deeply stuck in the esophagus, so it wasn't very easy to remove. And he had to undergo surgery. Thankfully, it went successful, and the watch was still ticking, actually. So we submitted it as an image in medicine with a catchy title called "Caught Up with Time." This is how you can, maybe if you write it as a case report and go in journals, you wouldn't find a place for it. Example on the right, this is again a case of a patient presented. Again, these were all from my emergency room duties in the Med 4 years. The patient came in with this terrible photosensitivity, patient with SLE that apparently used a herbal medicine from these over-the-counter herbal remedies that are very famous in Lebanon at the time. And when they got exposed to the sun, this happened. We took the actual product and we sent it to the chemistry department, and they found which plant was used in it, and we put it as a warning that this plant could, in patients with SLE, get something like that. But we published it as an image, but in the top rheumatology journal, Arthritis and Rheumatism, instead of going to a local journal, for example. This is another example of the quiz part, again published in a very high top tier journal, Gut, one of the #1 journals in GI. Again, a very puzzling case was for us as clinicians. Again, in my medical school years, where no one understood what they're looking at a CT scan. And then obviously we wrote the description, and in this first part, the first page in the journal, you see the CT scan and some sort of a question of what do you think the diagnosis is, and then on the right side you see the page that comes later. We see, okay, surgery was done, and it was, for example, in this case, it was a heterotropic pancreas, so a piece of a pancreas that was actually growing in the lining of the stomach of the patient. That's why the presentation was very difficult, for example. This is it. I had a section here to cover called author guidelines. I'm not going to go through it. It's very technical. I mentioned most of these before. The one thing that I wanted to mention are two things to conclude with. One is try to, as much as you can, if you're not already doing so, use reference managers when you're dealing with your papers. So when you're writing, there are EndNote, RefWords. There are many apps out there. EndNote is my favorite. Try to use those when you're writing, because imagine if you're writing a review article and you have 150 references, and then someone comes and edits, or the reviewer asks you to edit. You need to renumber everything altogether. They're very easy to use, integrated with Word, so I advise you to use those. And then the last bit is that do not underestimate the value of the cover letter that you will be asked to submit when you submit your paper to a journal. Most of the time, they ask you to put many technical things in it to say that this paper is not submitted elsewhere, all disclosures are there, we don't have copyright constraints. But try in the first part to tell the editor why this, they will read your abstract, but try to tell them in your own words, from a scientist to scientist, why this paper is important. Tell them that you've been struggling for the last 5 years in the country to find the good survival data on certain cancer, and this is the first time you were able to collaborate with colleagues to be able to give them some sort of sense of why this is important. And definitely don't spell their name wrong. Make sure you look at who is the editor to address them by name, and not just copy paste from an old submission, for example, where the editor have changed. With that said, I think the last thing to mention is, once your paper is coming back to you with comments, again, there is no rule or standard of how to address reviewer comments in a journal, but you need to make sure that most journals obviously ask you to submit a response letter where you take each comment that you received and tell them your answer to it, and obviously track the changes in the manuscript. Try to answer everything. Try not to show that you ignored something, and invest in your response, not only in the changes. Thank the reviewer for the comment that they said. Tell them, what you did in the paper. And I always actually copy for them the new text that I changed, so that sometimes they just read this quickly, the letter, they don't even go back to the manuscript, and they give a quick decision for that. And if you don't agree with the reviewer, that's okay. You don't always have to agree with them, but be polite about it. Say that, we really thank you for this thoughtful comment, but we don't agree because, and then you can explain yourself. So you don't always have to agree with the reviewer on something. Sometimes they ask you to do something experimental and you already finished your study. You can always say that obviously the study is closed and we cannot do this anymore. And maybe we will put this as a limitation, or in our conclusion as a direction for future work. So always find your way around the comments. As long as the journal sends you comments and invites you to revise, it means they want your paper. So don't give up and try to address all those comments. I'll try to now watch for the questions, if there are any, to address those. But while I search for those, I just want to tell you, in case people need to log off because it's already late, you will be receiving an email with a link to the AWS website, where you will find the actual recording, so that you don't only have the slides, but also me explaining them, because they might not mean something on their own. And we'll hopefully, if you don't mind, we were going to also send you some evaluation form, very quick 5-6 questions to address, to tell us how you found these webinars, especially if you attended them all, but even if you only attended one of them. And we will always keep you posted on any future webinars that we would do. Let me check for questions. I see here. Okay, they're in the chat, not in the question box. So you can write questions in the chat box or in the questions section. So we have many. What is the difference in Q1, Q2 journals? Again, it's a quartile. So if you have, let's say you have the impact factor from 0 to 10 in this category, let's say in rheumatology. So the first, let's say there are 100 papers in rheumatology, 100 journals, sorry, and they're divided from, they are arranged from highest impact factor to lowest. So the Q1 is the first 25, one of those. Usually they're the top journals, they're the most cited, the most read. Again, as I said, it's something that you need to decide where do you see your paper fitting, because it's not always you know, that you need to submit to the Q1 journal. If I was data collector, should my name under mention as contributor or acknowledge? If you just participated in data collection, to be honest, that's something to go under acknowledgement, unless you can always, you know, whoever you supported, you can always ask for at least looking at the paper, reviewing it, giving a comment, and then you can be obviously part of the authors group. To be honest, you need to have done something in the study if it was a study, and to have looked at the paper and gave some comment on it, even if the comment is I agree with all, and obviously to approve that it's submitted, and you automatically qualify as an author. Sometimes the question is, if you didn't do anything in the study, but you really contributed to the paper writing and so on, that still qualifies you as an author because you helped in the conceptualization while you're actually editing the writing. Okay, how do you select a journal relevant to your work? As I said, that my main approach is if you have access to Clarivate, which is the website that lists the impact factor and the journals in the various disciplines in medicine, you can see all the journal names. Okay, so the first thing to do is to say, okay, should I go for the top ones? I have something very important, or so I have a study in cardiology. So should I go to the cardiology section, I see all the journals, I decide which quartile should I be looking at, and then you can start by looking at the name of the journals. That tells you something already about the aims of it. So if it's the experimental journal of cardiology, I wouldn't put a clinical study in it because they're looking for basic science. If it's the journal of heart failure, I will not put a study about MI in it, for example. I will look for something general. If it's a study about the epidemiology of MI in the Gulf, I will not go for the American Journal of it. Maybe I'll go for the international journal. So you start, it's just a game of guessing at this stage. And then you go to that journal and see their guidelines. You see if they accept the section you're interested in, what are their limitations in terms of numbers and so on. And you decide on that. And as I said, you can always rely on familiarity, whether your colleagues, the authors, they know something about some journal that is always friendly with our area or with our groups. And also look at your own reference list, because you might see a journal being repeated many times. So maybe that's your actual best place to start. Does the journal have the right to access raw data? Some journal ask if it after many years. Yes, usually. So the raw data concept is mostly for clinical trials, usually for clinical studies and by a regulator. So you're sometimes by GCP guidelines, you need to keep them for 2 years available to be checked for regulatory purposes. Now for the journal, if there is something, if you published something 10 years ago and someone came after 10 years and questioned your paper, said this was a fraud data, they might ask you for it. And then if you couldn't justify yourself, they might actually withdraw the paper. So try to always keep your data as much as you can, as long as you can, in an anonymized way, in a proper place. Their right to ask for it, they always have the right to ask for it, but then you always have the right to not agree to that, and there is consequences. They might withdraw your paper or something. Now there is a trend to moving to data sharing, that we need to always keep the data anonymized for everyone to use to do these larger big data reports. there are different and mixed feelings about this, but this is the direction that people are going. Yeah, I agree. This comment is saying that there is that usually there is a lot of cost when it comes to publication in high impact factor journal. To be honest, not necessarily always. The open access, always open access ones, yes. Like if you go to Journal of Clinical Oncology, top in oncology now, or Lancet Oncology, it's optional, this open access. You can opt not to have it. So most big journals don't actually ask for it. Only if you want to, you can make it open access, and that's an optional fee. But obviously there are many journals out there. There are many even good journals and high impact factor journals. So you can always avoid the ones that look very commercial in the sense of they need to oblige you to pay for a fee. Can you elaborate on the time that we should spend while preparing different manuscripts like case report, letter to editor, retrospective studies, images, writing, and IRP? In terms of, it depends. If you mean the time spent on them, it depends. Some people just have it in them. They don't have a writer's block. Some people, I personally never stop when I start writing a paper. Even if I need to stay awake for a whole 24 hours, I don't stop until I finish when I'm ready with my data and I need to just write it. Some people write it in sections, they come back to it. Obviously, I always advise to just write it at the same time so you don't forget, because you feel it sometimes that the paper becomes fragmented. But how long you need to write, it depends on your skill set, it depends on your experience. I don't think there is like a standard time for something like that. I think this was the last question. I'm sorry if there are questions elsewhere that I couldn't find. But again, because it's already also late and I want to give you some time back. Again, thank you everyone for those who attended, whether you attended 1 or 4. As I said, you will receive an evaluation form. Please help us with knowing if these were helpful for you so we can modify them later if not. And we will keep you posted on anything else from VPS Healthcare or from the EOS to be able to attend those. Thank you, everyone, and good night.